Oh, all right. First of all, my name is Mohamed Wahb. I'm trauma and orthopedic clinical fellow in Frimley NHS Foundation Trust, working in Wixham Park Hospital. So now I'm gonna go through my presentation about the outcomes of major resection versus the gap balance size techniques in total knee replacement, and it's a local service evaluation in our hospital. So I'm gonna go give you guys a kind of introduction about our project. First of all, we've got two common surgical techniques are have been used in total knee replacement, which are the measure section methods, and that it depends on the anatomical bony landmarks to guide us during the femoral and the tibial cuts, and the other technique, which is the gap balance technique, which prioritizes the equal and symmetrical gap, and of course, that one depends on the soft tissue tension in both flexion and extension. There's evidence that about the outcomes of both techniques is heterogeneous, actually, with no general consensus. We have run this service evaluation to assess our local practice and to compare the outcome, including the poems between the measure section technique versus the gap balance. Um, so as I mentioned, that the assessment of our local practice, comparing between the two techniques, actually we used the Oxford knee score as our guidance to compare between the both techniques. Um, and the score that it depends on the excellent score that would be between 42 and 48, good score between 34 and 41, fair score between 27 and 33, and the poor score will be between 0 and 26. So we collected 60 patients, 30 on each arm were performed through the second half of 2023. Actually, that data is about retrospective data that including demographic data, age, sex, and BMI to ensure that it's comparable cohort. The post-operative data like surgical site infection and 18-month post-operative Oxford knee score. So we've got the results between the two techniques, the measure section technique and the gap balance technique. So we saw that the age ranges between 55 and 82-year old for the measure section technique, and 56 between 90 years old for the gap balance. The females, they actually equal in both arms, so they are 20 cases. The males that we found in measure section technique was 10, and actually it's the same in gap balance as well as 10, and the BMI that was 30.9 and 26.6 in the gap balance. So we found that the gap balance technique has the upper hand in the maximum score, scoring 60%, but the measure section technique scored about 43.3%. Um, Even though for the excellent score, measure section showed with the upper hand with a percentage of 53.3, and the gap balance scored 80% with the excellent Oxford knee score. So at the end of the day, that we found the gap balance technique demonstrated the superior clinical outcomes comparing to the measure section technique in total knee replacement in our local service evaluation. 60% of the patient in the gap balance achieved the maximum score compared to 43.3 in the measure section technique. However, the gap balance also had a higher percentage of patients with the excellent score. Actually, the fewer patients in the gap balance group fell into the good and fair categories, indicating that it's more consistent and optimal outcomes profile. The gap balance actually showed shorter hospital stays. It's about 30% versus 10.7 in measure section technique. But the measure section technique has a higher PMI, which was indicative. And we searched for another paper that to compare between the measure section technique and the gap balance. Um, Actually, that meta-analysis that was done on over 857 techniques from 11 trials, and we found that there's 441 knees were treated with a gap balance and 416 were treated with measure section technique. And that paper proved that the gap balance demonstrated better patients' outcome depending on the knee society score, um, comparing to the measure section technique. And the conclusion was the gap balance was able to achieve more crown alignment and better short outcome if we compare it to the measure section technique. And also, there's another evidence about another paper that showed as like there is no any difference between the two techniques. So as I said, the result is heterogeneous. They found that there is a 2 year follow-up. There was no difference between the function between the two techniques. However, the long-term follow-up will be necessary actually to evaluate the actual difference between the two techniques. The strength point for our project is comparable cohort. We have done it in elective center, 18-month prompts, good outcome measures, and there is not any pre-op scores to compare. But the limitations for our project was retrospective data, the small sample, the single center. We need to apply for more than one score and many phases as well. So the conclusion for our studies that we found that the current evidence remain heterogeneous with no definite uh, um, preference regarding the optimal technique. And our local service actually showed the upper hand for the gap balance rather than the measure resection technique associated with the increase of complication um, according to the Oxford NISCO and giving our high arthroplasty volume in our hospital that we suggested to do that project on a large cohort study so we can provide valuable insights and strengthen the evidence base. And this is our reference.